Hello friends, in this video we are going to see about the serratus anterior muscle in brief. In the previous two videos we have covered the pectoralis major, pectoralis minor and subclavius muscles. In this video we are going to study about the origin, insertion, nerve supply and the action in brief of the muscle serratus anterior. Serratus anterior is also called as the boxer's or the swimmer's muscle. Now, first point that we have to see, that is the origin of the muscles. These muscles arises from the 8 digitations from the upper ribs in the mid-axillary plane. Total 8 digitations are there. Origin points will be from 8 digitations different. First digitation appears in the posterior triangle of the neck, which arises from the outer border of the first rib and from the rough impression of the second rib. Here the first digitation, the rough impression of the second rib. Now the next point that we have to remember in the origin of this muscle is that 5th to 8th digitations interdigitate with the costal origin of the external oblique muscle. 8 digitations from the upper 8 ribs will be there. These are the muscles. First digitation from the first rib and the rough surface of the second rib, and remaining from the other ribs in the lower part. This is the origin of the serratus anterior. Let's see the insertion of this muscle. Insertion: muscle is inserted into the costal surface of the scapula along its medial border. First digitation, superior angle to the root of the spine. Second and the third will be the lower down on the medial border, whereas 4th, 5th, 6th, 7th and 8th gets inserted into the large triangular area over the inferior angle. Now diagrammatically how we can show it is that this diagram we can show that here first digitation at the superior angle, this all the total 8 digitations of the serratus anterior muscles gets inserted to the medial side or the medial border of the costal surface of the scapula. Here at the superior angle the first digitations gets inserted, then the second on the medial border and the remaining 5 digitations on the inferior angle of the scapula, inferior angle, that too on the medial border. In this way, we can see the origin and the insertion of the serratus anterior. The points that we have to remember, it seems to be somewhat complex, but easily we can remember that 8 digitations are there, whereas first digitation from the first and the second rib and remaining to that respective ribs will be there 8 digitations and gets inserted to the medial border of the scapula. Now nerve supply, we can see that roots C5, C6 and C7, which is also called as a long thoracic nerve. Here C5 it will supply to the first and the second digitation, whereas C6 to the third and fourth, whereas C7 5th to 8th digitations. This way commonly what we have to remember is that root C5, C6 and C7 supplies to the muscle serratus anterior. Now actions in brief, we can say muscle steadies the scapula during weight carrying. When we carry the heavy weight, this muscle steadies the scapula. Pectoralis minor, along with this muscle, that is the serratus anterior, it helps to pull the scapula forward and it also helps in the forced inspiration. In this way, we have seen the origin, insertion, nerve supply and the action of the serratus anterior. Thank you.